many Americans would agree, regardless of their political affiliation, regardless of how they feel about what's happening at the CDC and HHS right now, that Americans are unhealthy in general, that Americans are sick, that the American health system has not been working for years. Why hasn't it? What hasn't been working?
Yeah, I think that's the right diagnosis, and the big question is, what are the drivers of that? And there are many. Starting at the healthcare level, healthcare is a small component of people's overall health, but it is important, and we're the only wealthy nation in which your ability to access healthcare is so dependent on where you happen to have a job. There are millions of people in our country who work more than one job per day who don't have access to high quality, comprehensive, affordable health care. And without that, they will tend to show up in emergency rooms. They'll show up late for care and be sicker. We also are seeing with the latest legislation out of Washington that tens of millions of people, in addition, are going to lose their healthcare access. So that will move us in the wrong direction. Some of the biggest drivers of health have to do with income and whether someone has the income to be able to afford healthy, nutritious food, whether they have the income and the leisure time to be able to get physical activity. These are critical components of health in America. But we are seeing that in America, the rates of chronic disease are extremely high, and we need to do more to address that. So I think that there probably is a lot of agreement around what the problem is. There is less agreement in terms of what the drivers of that are or what the solution should be.
All right, so let's get to, and I want to bring in Bloomberg News health reporter Jessica Nix, who wrote this story with Madison Muller. And Jessica, in your reporting, you note that there's a small but vocal contingent that's long been demanding changes at the CDC. And then with an ally in RFK Jr., the HHS secretary, finally getting these critics kind of getting what they want. But scientists are really worried because they feel like they've been sidelined. What is everyone so worried about?
Well, we've seen in the past few months since RFK came in to take over the Department of Health and Human Services, a complete dismantle at the CDC for what we've seen in the past. There was a lot of criticisms of the CDC during the COVID pandemic in terms of guidance around what schools should be doing, social distancing, masking. It really divided a lot of the public. Since RFK has come in, we've seen mass layoffs in terms of divisions that study chronic disease, gun violence, injury prevention. We've also seen the dismantle of a vaccine panel called the Advisory Committee on Immunization Practices, who's supposed to meet next week, and handpicked members from RFK have now come into that panel and dismantled vaccine policy as we know it. In August, we also saw a shooting at the CDC, where the CDC was the attack from a gunman who fired nearly 500 rounds at the buildings. Weeks after that, the CDC director was fired weeks into her tenure over vaccine policy. So there's so much confusion and chaos at the CDC that the actual work is not as able to get done because everyone's gone.
So Dr. Besser, let's bring you in. I mean, the worry's justified. Do we need, I guess I want to take a step back because I think it's fair to say that sometimes we have institutions that have been in place for a long time, and there are aspects that get a little stale or that maybe could be improved. And so it's good to take a look at things. But I'm just wondering your view as a former acting director of the CDC, what needs to maybe be fixed at the CDC? What is maybe wrong about the current approach, and what is right maybe about the current approach?
Yeah, I mean, it is so important to look critically at our institutions and ask the question, how can they perform better? Where have they not performed well, and how do you address that? It's critical. I worked at the CDC for 13 years under Republican and Democratic administrations. I ran emergency preparedness for 4 years during the Bush administration, which is why I was made acting director at the start of the Obama administration, to be able to respond to public health crises. What we're seeing here is the destruction of the world's leading public health agency. The CDC doesn't just provide public health expertise for the United States. It had been looked at as a beacon for public health around the world. That's no longer the case. The administration came in and haphazardly fired tens of thousands of federal health workers, so many people at the CDC. For an administration that is concerned about chronic disease, they eliminated the Office on Smoking and Health, and smoking is the leading preventable cause of chronic disease. There hasn't been any coherent approach to this. At the start of the Obama administration, there were efforts to look across the agency. Where was it lacking? Where could it do better? Before the start of the COVID pandemic, the public's take on the CDC was very high. It had very high approval ratings. But we saw with the COVID pandemic, CDC make some mistakes, but we also saw the intentional politicization of public health by an administration that saw the opportunity for political gain. And so across the nation, we saw hundreds of talented public health professionals be vilified. People leave their jobs, some forced out, some not able to take the stress or the blatant threats to their health and safety. And now with this administration, at a time where we need to rebuild trust, we have, as our Secretary of Health, one of the nation's leading anti-vaccine advocates and someone who has demonstrated no respect for the Centers for Disease Control and Prevention.
Dr. Besser, you mentioned that the CDC is this beacon of global public health. We saw what they did during the COVID pandemic, but what does this mean for future pandemics that might pop up if we have a dismantled CDC, not just for the US, but also for the world?